give a thought. You are right. One is simply vitamin K problem. Another is multiple clotting factors problem, production problem. Two things are different. One is more sick, hepatocyte disease. When does the bleeding starts in hepatocyte disease? Either portal obstruction, that means localized bleeding, GI bleeding, okay, or then hepatocellular failure. And what is biliary? Generally not a very sick child unless there is a cholangitis, otherwise not sick. So at that stage we want to see. Now first tell me that nasal bleeding, would it mean that there are multiple areas that are bleeding, not only the intestine? What do you think about nasal bleeding?
So in general, how would you analyze a child who comes to you with a nasal bleed? What is the commonest cause of nasal bleeding? Nose picking.
Yes,
so why is this not that?
He has also said bilateral.
Very good. So it is bilateral. So that is first thing that should strike you. Okay. So this is not the usual nose picking. Then
so the nose bleeding is either platelet or coagulation factor. Anything else can also bleed. Platelet and coagulation factors, yes. What else?
hypertension.
What happens in hypertension? Why is there a bleed? Though generally in children we don't, because hypertension has to be so severe and chronic. If it's acute and severe hypertension, you get into hypertensive encephalopathy or a cardiac failure. So chronic, severe, then only those symptoms come up. So in pediatrics we don't see that. Any third reason? Vasculitis. Okay. So platelet, coagulation factor and vasculitis. For example, a Wegener like we showed could come with nasal bleeding because it's a vasculitis. When there is a lung vasculitis, it is consolidation, equivalent of pneumonia, but any other. So here we want to know whether which of the three factors are operating here.
What do you think? This is a platelet disorder, coagulation disorder, or vasculitis? This epistaxis. Why? Good. Why? No, liver involvement है इसलिए coagulation नहीं. Take the epistaxis itself and decide which of the three. Then you add it to whatever else you have got. So suppose it was platelet disorder. What should have happened also? Petty would have happened. Are they there?
No.
No. So you say, okay, this is mostly not platelet. Correct? And now for vasculitis, what else can you look for? Vasculitic rashes anywhere in the body, other skin rashes. Can that abdominal pain be vasculitis?
Yes, sir.
It can be, right? So we are not very sure whether we will label it as, but I think bilateral would go in favor of a coag disorder.
And so all that we know is that there are multiple sites of bleeding. So vasculitis, coagulation factor defect, platelet unlikely. Now if it's a vascular also, it seems to be localized to two areas, nose and GI. While it cannot be ruled out, generally vasculitis is a localized disorder, okay, whereas this looks to be a little generalized. But even in generalized, it's not all over, it's only in two sites. So the question is, what is it? Is it coagulation factor defect? But you don't get nasal bleeding there. Okay, nasal bleeding is thrombocytopenia, yes, or a multiple site bleeding. Okay, so if it's a hepatocyte bleeding, it's only GI. So could look at the black stool. What does black stool mean?
Upper GI and what else?
GI.
So can a epistaxis cause black stool?
Swallow the blood. Nasal bleeding, swallowing can lead to tarry stools.
So then what one issue is important here? the typical these people who dig their nose and get epistaxis, do they get black tarry stool? Why they don't get? They also swallow. Huh? Anterior, that means you're saying it all falls down. But suppose they swallow. Quantity matters, no? For you to get white tarry stools.
So this is a large quantity. Okay. So I think at this point of time, we only know that what started like a non-infective, non-inflammatory disorder probably, so we called it metabolic, and hepatocyte disease, which is now gone into some complications which could be commonly coagulation factor defects more than vasculitis or platelet. Now the question is if that is so, and all that has happened in a short time, in a healthy child. So
Yeah, means he's presented for the first time at 9 years.
yes,
And
then he was
this
all right.
nasal bleeding was along that illness
Yes,
only?
sir. At the time of the
At the time of
acute
that
acute
illness. Okay.
Okay. So he got well at the age of 9 years.
Yes, sir.
In between he was all
Those-
right.
Sir, this whole story is of 9 years only. At
Okay.
9 years.
Okay.
At 9 years, some 4-5 days fever, yellow, and then that pain which got better in 3 days, then nasal bleeding, all around that 9 years.
But he is 11-year-old now.
Now he was well in between
Yeah,
after
so-
this
So
episode.
that recovered.
This whole episode recovered. He was diagnosed and something happened. And now he has come back.
Sir, can we have the papers of the disease which he was treated 2 years back?
Yeah, all that is, sir, there, records. But we are just analyzing clinically.
So
Okay.
now we add one more adjective to it. We would add that it is a treatable disease. With the right treatment, naturally getting better. Okay. There, the metabolic disorders go down a little. Metabolic disorders would have been progressive. Some of them are not correctable. So, if it's a metabolic, then it's non-correctable. And if it is so, then why did it get well in between? So then the question is, are we dealing with an autoimmune? And if it's autoimmune, vasculitis is also immune. So we keep all these issues in mind.
So what about Wilson's?
What about?
Wilson's.
Wilson's is one possibility if we say it's a hepatocellular failure. Now this bleeding doesn't look to be hepatocellular failure by itself because that would have caused encephalopathy as well. So to me, possibly not. Commonest metabolic disorder is Wilson's. In fact, the rule is beyond 5 years, still proved otherwise, metabolic liver disease is Wilson's. And Wilson's have a very wide spectrum from an acute fulminant Wilson's to a very chronic, slowly worsening Wilson's. So acute fulminant Wilson's should have had a hepatic encephalopathy with or without bleeding. This guy doesn't seem to have encephalopathy. And then he got well. Wilson's would get well from encephalopathy, but will continue to be having jaundice, etc. And merely because you treat with penicillamine or zinc, the patient would not recover completely in between two. So I think these are some of the issues that we have to fit in, that 2 years normality in between, treatable condition, what looks like hepatocyte, what looks like non-infective, maybe inflammatory, we are not sure. So I think this is what it looks like. Again, this means that as a rule, when we do not understand clearly, we are hitting on some rare condition. That's the rule. Okay. And that rare condition cannot be considered easily on history alone. Because history takes care of common condition. Of course, common are 95% history. After all, every time all postgraduates present to begin with to say, history given by mother reliable. How do you know it's reliable? Because its mother is reliable. So how do you test reliability? Okay. What I say because I'm senior, you think it's reliable.
The person should be
but that is
staying with
not
the
so.
child during the illness. When
Yeah, Yeah, so it's good to find out whether the person knows everything about the child, that is one.
And ask more details. Okay, when the story is going on for some time, tell us on first day what happened. Now she has to start thinking, you know that she has not observed so closely. Or what happened after 2-3 days. So I think what I mean is that many times when we don't fit in easily, either a rare disease or some points in the history are missed. We keep both in mind, but these are actual life situations. We don't complain about it, but doctors must understand both, right?
Okay, now tell us your provisional diagnosis on history and then examination findings.
And discharge on a few days only.
No, no. This episode was discharged in few days, no?
Yes, sir.
Discharge in few days. Treatable in few days. Okay. So-
During the first episode, the child was treated with medications for 9 months, sir, and the child was symptom free after starting medication, 2.5 months after starting medications.
I think that's a very
So-
important thing. The child was treated for 9 months.
Yes.
Is that 9 months treatment? I want to know details about that.
ठीक है, come. We'll see, sir. Sir.
Yeah.
Yeah.
Summaries. 11-year-old girl child, born to non-consanguineously married couple with significant birth history, developmentally normal, immunized till date with a dietary deficiency of 376 kilocalories, belonging to upper middle class, with mother being known case of SLE on medications, presented with recurrent episodes of jaundice since last 2 years on medications, was brought to currently with jaundice since last 2 months with no bleeding manifestations, with no history suggestive of encephalopathy, with a chronic liver disease, probably Wilson's disease, autoimmune or alpha-1 antitrypsin deficiency.
Fine, that's what we discussed. So, Wilson means metabolic example, Wilson, autoimmune and rare disease. So, fits in, go ahead.
On general physical examination, child is conscious and oriented to time place person. Vitals, temperature, child is febrile with pulse rate of 84 beats per minute, good volume, respiratory rate of 22 cycles per minute, maintaining saturation at room air, pulses well felt, extremity is warm, CFT being less than 3 seconds, BP is 108/76 mm of mercury. Anthropometry wise, height is 139 centimeter with expected 147 centimeter, comes between 10th to 25th centile. Weight is 29 kgs, expected is 38.6, comes between 3rd to 10th centile. BMI is 15.01 with expected being 17.7, coming between 10th to 25th centile. Severe thinness is there. On head to toe examination, no thinning of the hairs, head is normal, no face, no parotid swelling, eyes icterus present, no pallor, dryness or corneal ulcerations or Bedford spots, cataract present, no cataract present, or subconjunctival hemorrhage, oral cavity, no bad odor or no bleeding gums, ears ears are normal, nails are no white discoloration of the nails, no palmar hands, no palmar erythema, chest no red rashes or spider neve, skin no rashes, petechia, palmar erythema, ecchymosis. On examination on inspection, shape of the abdomen is normal, moves all quadrants equally with respiration, umbilicus is normal, no skin scars, no superficial visible veins. On palpation, it is soft, no local rise of temperature or tenderness, no rigidity or guarding. Liver is palpable 2 cm below the right costal margin with smooth consistency, smooth margins and non-tender. Percussion span of liver span is 10 cm with no signs of free fluids. On auscultation, bowel sounds present. other systems, CVS S1 S2 present, RS bilateral ear entry present, no added sound. CNS GCS is 15/15, conscious and oriented, no tremors, tone is normal and no focal neurological deficits.
Spleen is not there, no?
No, sir.
So what has examination added to your analysis? So now relevant
In Wilson's
eye
disease,
signs, yeah.
there is a very, very specific sign
Yeah, corneal
which
ring.
you have to see it with a slit lamp. It is called as Kischer-Fleischer ring. Did you find it?
It was examined here, sir, by ophthalmologist. There was no KF rings present.
So there was no
No
KF
KF
ring.
ring present.
Does it make any sense, sir?
Absence of KF ring doesn't rule out Wilson's. Okay, so to that extent, we must look for it, but even if it's absent, Wilson's is not ruled out. But let's look at each. Just put your thing. Not too many things. This is all right. We already discussed. There is nothing much on this. Okay, there is nothing much on this.
So on examination, we have
Come
got
there. Come there.
Yeah.
Now, what do you make out of this? Soft liver. And on one hand, we are talking about a chronic liver disease. Okay. And the liver is not much enlarged. 10 is a borderline normal. So one would wonder whether the liver is really enlarged or not. And certainly soft liver is almost always non-pathological. And suppose there was a soft liver, but it looks like much palpable in the abdomen, then the span will not be so large and the liver could have been pushed down, normal liver. So soft liver bothers me. But what is soft or firm?